Hello, everyone. Welcome to the Global Gastroenterology. Today, we welcome Dr. Nakaya. She's a gastroenterologist from Brazil. Thank you so much, ma'am, for giving us your valuable time. Can you please briefly introduce yourself to our viewers?
Thank you, Omer. So, hi everyone. My name is Cassia Nakaya. I'm from Brazil. I live in a city called Curitiba, which is located in the south of my country. I hold a degree in general surgery and digestive endoscopy, but currently I dedicate myself fully to the field of advanced endoscopy procedures like ERCP and third space procedures. I currently am the head of gastroenterology and endoscopy department of Hospital São Vicente de Paulo. And I also practice at two major hospitals here in Curitiba, where I oversee our residents of our 2-year programs of digestive endoscopy training, where we teach them to gain comprehensive experience, improve their skills in both the diagnostic and therapeutics procedures.
All right. Thank you so much, ma'am, for your introduction. So, before moving forward, we would just like to know about the healthcare in the Brazil. Is it like the government supported, or it's just like the health insurance? Is what kind of health insurance system do you have in the Brazil?
So here in Brazil, we have free public health. So every citizen has right to access to free health if necessary. 90% to 100% of population use it because our population here is most of them live in a poor situation. But we also have health insurance assistance like private assistance. I'm the one. I have one. I have private insurance to the health system because even with the free health access is completely limited. So you can't have everything. You can have all kind of surgeries. You have just the basic ones, right?
All right.
So
Thank you so
yeah.
much. So moving towards our next question. So how easy it is for the patients to get these advanced procedures, as you have most of your expertise in the advanced procedures? So how easy it is for the general public who does not have the private insurance, and they just want to be get treated on the government funds? How it's easy for them to have these procedures done that you are expert in?
It's actually pretty easy to access, but the time of waiting in the line is long. They wait around 1 year or 2 years to get a consultant of a specialist, or they wait another 6 months to get an endoscopy or a colonoscopy. So it took some time, a lot of time, and this is the most difficult part to deal with it. Yet some procedures are covered for in free public assistance, like mucosectomy. Is covered, but another more invasive ones like ESD, WEM, ERCPs. Sometimes is not covered, so is you have to pay for those procedures. Is not cheap. It's very expensive.
Gotcha. And to see a consultant, can patients directly come to you, or they need the PCP, primary care physician's referral to see you?
Yes, they need to go to primary care, where is a general clinic, general doctor. He evaluates the patient, and then he directs if it's necessary or not to a gastroenterology, and then an endoscopy, and then so on. So the patient does not come straight to us. It has a filter.
Gotcha. And being in the gastroenterology field and doing the advanced procedures, what challenges you feel that our patients feel these struggle with these challenges in the digestive health? Anyone, any challenges you would like to highlight today?
I think the long awaiting list of patients. We have thousands of waiting listed patients, and sometimes they die waiting because they don't have access. We don't have enough support to attend all the population. So we have Brazil is a really big country, and we don't have much specialists enough for to attend all of them. So I think this is the most difficult one. So what the people, what poor families do, they gather some money and and then they find some private practice or some private doctor to try to have the surgery, in particular private, right? They pay for it, but it's a minimal part of the population. So I think this is the most frustrating for us and the patient, is the long waiting list.
Yes, you are absolutely right. So now I just got a little bit idea of the long wait time could be a big hurdle in getting the care that we need. And so I just wanted to know that h- how common is the colorectal cancer in Brazil, and what are the barriers for the colorectal cancer screening, and how often patients can get the colonoscopies? Is it like a usual trend that patient come and get screened for the colorectal cancer via colonoscopy, or just people don't ignore it? What are the common barriers that you think that are preventing from the colorectal cancer screening?
Okay, colorectal cancer. Our statistics doesn't show. Doesn't It's not very. The percentage of our colorectal cancer changes every year. But last I searched, last year, it shows more than 40,000 new cases here in Brazil, so it's increasing every year. But we do a lot of campaigns of conscientization, of prevention. So people now they know they have to seek for a specialist or ask for this exam to, because they can watch on TV, they can listen to the radio, and they see on social medias the indications, right? 45 years old, and or if you have a family history, you have to seek a specialist. They are gaining conscience about this situation. So I think we're doing a good work here, and the population is becoming more aware about this subject. But what we see, we still see, is as a lot of patients who, when they first come to our first exam, he's already has some kind of cancer, initial beginning, but sometimes it's too late, and they have to go to surgery or anyway chemotherapy, and so.
Gotcha. And so now we are just talking about the diagnosis of the colorectal cancer. For example, if a patient comes to you, gets diagnosed with the colorectal cancer, and you have to give the referral for the surgery, oncology, what do you think? How coordinated care do you have in the Brazil, or especially in your cities? Are these consultants are readily available when patient gets diagnosed with the cancer, or it's again a long time to see them?
Yes, in the hospitals that I work is kind of fast, because they get the histology confirmation, and we already direct them to oncology or oncosurgery, and it's not that it's kind of fast. It takes around 2 or 3 weeks to get the first consult to oncologist, and so he can plan his better treatment, because we are inside he's already a patient of our hospital, you mean? So he's already he's already inside the patient's already inside the hospital, so he can have access to all the specialists of the hospital. But if the patient is not yet a patient of the hospital, so it's a little bit more complicated, because he's still waiting for the first consult to the gastroenterology, even though he's already is potential patient having a cancer, a colorectal cancer. So this part of waiting, it might take, like I said, 1 year, 2 year. So this is very concerning and frustrating as well.
Yeah. And for the colorectal cancer, what are the danger signs? If the patients are having those symptoms, they should go and get checked by the gastroenterology just for the awareness of our general public.
Yes. So when they have some kind of symptoms like bleeding or losing weight, or anyway some red signals, alarms, he goes to a doctor, to a clinic, general clinic doctor, and it doesn't matter if he's 20 or 30 years or 40 years old. The doctors are already they are already aware they have to to ask for a colonoscopy. So I think the screening is increasing in those kind of population, even younger one. And I think this is great, because in here what we do a lot of diagnostic of younger patients, and sometimes they have a medium or a big polyp, but he's already a potential patient for future cancer or something like that, right?
Yes.
So
That,
yes.
that's really alarming given the increasing trend of seeing the colorectal cancer in young patient populations. What do you think? What are the risk factors? What population can do to prevent these cancers?
Yeah, well, I don't know. I think that there must be some more studies, like randomized studies, to evaluate why colorectal cancer is happening in younger population even more. Are we diagnosing much more? Our technology are becoming better, or is something with mutation, genetics, our food is changing, what's changing, right? So this is a very big question of the century. I think it's very challenging to find out, what's going on, or what's happening, right? I don't know about your opinion, but I think there's something in there, like in the food or the water and the more diagnostics.
Exactly. And to my understanding, more processed food, that's also contributing like some portions of increasing trend. Thank you so
Yes.
much for this colorectal cancer awareness. And now we'll move towards your next areas of expertise, your ERCP. Can you please tell what is ERCP and when it's indicated and how it gets done, if you could try to simplify for our general population?
Okay, ERCP, we work with the biliary duct, right? Ducts, stones, and pancreas as well. I work more with the biliary duct, with like stones, strictures, and tumor as well. I'm not expert. I'm still beginning, because I'm 5 years old of graduation, that I finished my training program. But I like to adventure myself in this kind of area, this expertise area. So so basically, we what we do is to remove the stones impacted on the duct, biliary duct, or we dilate strictures, some undefined strictures, or maybe some potential malignant strictures. And we also drain patients with tumor. There is obstructing the duct, and we sometimes have to put some kind of draining, internal draining, to and so he can move on with his specific treatment.
Gotcha. And I would like to know about any other procedures you are specifically interested in that you would like to talk about.
Yeah, so like I mentioned, I'm starting with third space procedures like ESD, POEM, but I'm still very in the early beginning of my career. So, but this is something that interested me a lot. And I like echo endoscopy, ultrasound endoscopy. It's something really interesting, and I think it has a whole potential for like everything in the gastroenterology world. Is really really good resource.
Got,
So yes.
gotcha. And so, as you mentioned about endoscopic ultrasound, what kind of patients needs those services, and what is that exactly for our general population?
So we indicate ultrasound endoscopy with patient to investigate some kind of lesion, to determine the size, specific size, and the layer that is compromising. So we can also do biopsies with directed biopsies of the lesion. You can analyze later. So if it's a potential cancer or it's a benign lesion, right? And also there's a lot of things that is already is happening, and they are developing new tools every day, like gastrojejunal anastomosis, biliary gallstone drainage of the gallstones, right? What else? I think that's it. I'm still beginning yet, so I'm not very expert or something
Gotcha.
like that.
No worries. Thank you so much. Thank you so much for giving us all this information. Now we will just quickly move towards our concern of liver cirrhosis, liver fibrosis. Do you like to comment what are the prevalent causes of the liver cirrhosis or liver fibrosis in Brazil? Is it like hepatitis, or is it like obesity, or is it alcohol? Because every country is dealing with a different kind of challenges. So I just wanted to know about what's the situation in the Brazil.
Yes, correct. So here in Brazil, nowadays we're facing a very concerning situation, that is the metabolic associated fatty liver disease. We have around 35% of population, so it's pretty high rate nowadays in our population. And what I searched here in Brazil is the most concerning topic of our country, because back in the time it was considered just like a developed country problem, right? But now
Yes.
what we see is an inversion of the situation. And experts they try to explain that is related to the fast urbanization of the third world countries, which drives them to bad lifestyle habits, no physical activities, processed food intake, refined sugar, saturated fats, long hours of duty. So everything, all of this, the consequences is what we see observe in nowadays, right? Obesity, metabolic syndrome, and diabetes is pretty very prevalent here in Brazil. So I was just searching, and the global prevalence of metabolic associated fatty liver disease is around 25%. In Brazil is 35%, so it's higher than the global prevalence. And this data is very concerning and show us that we're going to a dangerous path. So I think we need to take care about that, because I think it's going to be a big problem in the future, so not so long.
That's really alarming. So I just wanted to know, like, how often you encounter the liver failure patients, just a general trend in the Brazil, and what are the mm resources for the patients who can get the liver transplant, or is there any streamlined process for getting the liver transplant? And how does it works, liver transplant in Brazil?
Yes, I think it works just like in the US, right? You have to wait in a unique list, so you just have to wait. You can not pay or not have any kind of what's the word? I'm sorry, I forgot right now. Try to remember later. So the process here is you have to wait in a single list. So it doesn't matter if you are rich or poor, you have to wait. Um, I think in US is the same, right?
Yes.
Yes. So the process after you test all compatibles, genes and bloods and types, you are a potential candidate. And the results here are are positives. They patients, they get to get back to their lives. They keep following with specialists, and the results are very good. I don't have the statistics right now about it, but here in Curitiba, we're not a very high reference for liver transplantation. It's pretty basic, concentrated in São Paulo, Rio de Janeiro. They do a lot of transplant of heart, liver, and etc. So I think this is the information that I have.
Interesting. Would you like to mention any specific hospital names that you know they're very good in liver transplantation, or any any resource you want to share with our viewers?
Okay, the main hospitals in Brazil are Hospital das Clínicas, Rede D'Or, Hospital Albert Einstein. So I think this is the main reference in Brazil.
Thank you so much. And this is the last question we ask every guest. So, what
Okay,
do you recommend the young healthcare workers that how they can avoid the burnout?
for
What
those
do you
young.
usually do? What you usually do just to keep going? And it's very daunting profession. And how do you keep yourself going? And just avoiding this. Just share your tips that you have for us.
Okay, so I think I would say like physical exercises, and something that I really like, but it's my personal opinion. I like to travel a lot. Like it doesn't matter if you go to the beach or another country. This is something that just makes me relax and takes the tense off myself. So this is my tip that I can give to the younger one. What else? I like to study languages, so this is something that I recommend. Another kind of study, but you exercise other parts of your brain. So sometimes it gets funny, and so I think it's some kind of escape that
Mm.
for that as well.
Yes. Absolutely right. Thank you so much for giving us your valuable time, and it's really amazing. I guess some of the discussions we have, it's gonna be useful for the general public in the Brazil. The references you provide, the overall picture you draw for our viewers, it's really helpful, and I am really thankful to you for your time.
I thank you, Homer. Thank you very much for the invitation. And just want to say that everything that you're doing, your project, I think it's amazing, and I'd like to congratulate you. Uh, so thank you very much, and congratulations for this initiation. So it's very inspiring.
Thank you so much for your kind words. Really appreciate it. Have a good night.
You too. Thank you. Bye
Bye.
bye.